steps immediately, it costs less than waiting for a gigantic disaster. And so I want to emphasize with you to take a deep look at the implication of SB 43. On the surface, it might look like a lot of money, but if you start adding up the disaster costs when things get totally out of control, I think you might be able to find a balance there so we can implement this and save some lives. Thank you very much.
Thank you, Linda. All right, next item, approval of the agenda. Can I get a motion to approve the agenda? So moved.
Second.
Okay, Chris and Christie. All in favor?
Aye.
Okay, it passes. Approval of the minutes from December. Can I get a motion to approve? Any comments on the minutes? Any issues with the minutes, Dee?
Yeah, I submitted some suggested edits to Christina on Sunday. I didn't hear back, which I wasn't expecting to because I don't know the process in its entirety, but they were rather non-substantive, and I don't think anything that will hold them up from final approval.
Yes, I received them.
Okay, so what were the changes?
Just a correction to the spelling of my first and last name, and then some added specificity to the update that Christie gave under the program committee reporting period.
Do you have those, Christina? Do
I have her email, yes.
you want to, can you read? Is it, you want to read?
Yeah,
Changing of the name, spelling, so we get it right, sorry. And then,
I'll hold you out, Christina.
yeah, you know what, Christina, we'll have Dee read the substantive changes.
So first one was on page 2 within Jonathan's section. Just edit to read the all varies to be consistent with how it was referenced throughout the rest of the minutes. And then on the same page 2 within the program section, my recollection of the action item during our committee meeting was as follows. D will reach out to District 4 West Sacramento City Council member Verna Sulpicio Hole to obtain a recommendation on a mental health services representative within West Sacramento, paraphrasing, who can present on the imminent mental health needs of West Sacramento. And granted, Christie, we give more time to remember what we said and what we discussed, and I just want to be more explicit on those updates so that we can back into specific information when we're recalling what we have done, especially when we get to the annual report.
Right. Okay, anyone have any issues with those changes that Dee's recommended? Those are changes, those aren't,
I understand that. I was just still looking for where they belong.
oh, well, I think they're pretty, the email, is it clear?
The
Christina,
last,
where
in
they-
the last, the
well,
last.
I think I'm just not sure where it's supposed to go.
Oh,
So just under the
What area, Dee, is that?
Let's see, let me grab the notes really quickly.
we just.
Yeah, I think it's program committee.
Yeah,
okay, for your program committee.
Oh, I see. Okay, okay.
The pages aren't numbered, so it's hard, but yeah, the second.
You know, it's at the bottom of the
Yeah.
second.
So
page.
this was from your committee meeting that you held together
yeah,
A report
to
of
be
the
noted in your
committee.
committee meeting minutes.
Yes,
Okay,
to be noted,
those were the 12-4 minutes.
to be noted in the minutes of our meeting last month.
Okay.
About their meeting.
okay.
All right,
Thank you.
yeah, thank you. Is there anything else? Okay, I'll entertain a motion to approve the minutes.
I'll motion
Dee,
with the edits as
with the edits,
stated.
I'll second.
second from Christie. All in favor, say aye.
Aye.
Opposed? Abstentions?
Abstaining.
Joe abstains. Thank you. Okay, any number announcements? No? Okay, chair report. So as many of you know, I have retired from the county as of December 31st, and then last Tuesday started a new job with the California District Attorneys Association. So now I kind of have more of a statewide, hopefully impact on things, and hopefully will bring some of the these issues to our members statewide. And yeah, so that's what I'm doing now. And that's all I have. Bylaws.
The ad hoc committee wants to put this over another month. We found a memorandum from the board changing membership terms from 2020 that is inconsistent with what we have in our bylaws, which are based on a 1993 ordinance, our county ordinance. And so we need to do the rewrites to make it consistent with the 2020 board action.
Great, so we'll get those out before the next meeting so people can review them?
Yes. This would be a cut and paste in a couple places.
Okay.
And I'll just say that came up when so I found out my term was expiring, which was inconsistent with the ordinance for this board. So that's how I caught that. That's why I was so late, because we couldn't get it done today.
Got it. All right, thank you. Okay, standing committee updates, budget and finance, Joe?
I had a comment for the bylaws, if we're still able to comment to
Yeah.
that. I had emailed you specifically, and I wasn't sure, I'm trying to understand who to best communicate these to so that we all get an opportunity to weigh in on suggested edits by the board. But nonetheless, understanding committees, specifically, let's see. With the paragraph starting, there are 3 standing committees of the board appointed by the board chair. I bolded this section by carrying out specific tasks assigned as needed by the board chair and/or board. For me, this is where the clarity is needed. I would presume that what we're saying there is that the subcommittees would take on work at the direction of the chair and/or board chair. Is that how I'm interpreting the bylaws to be read?
So that's how I interpret it. I don't interpret it that to have a lot of breadth, as the subcommittees just decided they're going to meet on their own. These committees will review items as needed by the board chair and as requested.
So then my follow-up to that would be, if no specific tasks are assigned, what activities should the committees undertake to continue the work necessary to report back updates to the board chair and/or the board? I think absent refining the latter, will run the risk of individuals deviating from the core objectives and goals of the LMHP. That kind of goes back to what is that binding document that governs technically the independent work of the subcommittees or committees.
So what would you like to see us? Would the best thing be for then the subcommittee chair comes back to the board and asks them for direction, or what do you think should happen?
I know one of the action items I had really early on was to read the current newly executed mental health report. And there was a slew of work that went into that clearly outlined what the objectives are. And I know that I understand that the Health and Human Services staff have majority of responsibility of that work, but I think absent tasks and/or assignments as the bylaws read, being assigned by the chair or the board chair, then we're left with wondering, well, what did we work on if there was nothing tasked at said meeting? What is that? Then what do we redirect ourselves back to as a guiding document to help us continue to achieve the goals and objectives of this effort? And I think absent that, we may be floundering a bit and trying to guess. But I'm new, so this is.
No, I'm just trying to
newer.
get to the heart of what you're saying. So are you saying that if if they don't have tasks from the board or from the chair, then they should look to that document for guidance?
Yeah, like, for example, I work for a state department, so our governing document, our roadmap is the strategic plan. And that sets forth the tone for the next 3 to 5 years. That's how I look at the mental health services, or the plan that was newly executed. And it tells the Health and Human Services exactly what their stakeholder engagement, their feedback rolled up into this beautiful report laid out for the next wave of mental health services and the budget. So to me, that was the more akin to what I would see as a strategic plan, or like a roadmap that kind of paved the way, so. I think,
I'm sorry,
And I was,
Ron would probably
no, I,
like to-
no, I was gonna actually, in the back of my, head, were looking towards you for
The,
some help here.
yeah, my sense of this on standing committees is that the general charge for the committees is in here. And that it would be the decision of the committee, how to act around specific issues. So let's say, unless there was a directive from the board or the board chair. So let's say I'm on the Budget and Finance Committee. Reviewing and reporting on legislative proposals. I wouldn't expect that the chair or the committee itself would have to tell me which legislative proposals. I suggest that I have to keep if I'm on this committee, I need to keep my ears open to the kind of legislation that's being proposed, talk about it in committee, and when appropriate, bring it to the board. That would be the sense that I would have from this enabling document.
So I construe this a little more narrowly. And it seems, the language is pretty specific. It really starts out the purpose of the standing committee shall be to assist and support the board carrying out specific tasks assigned as needed by the board chair and the board. So I read that very narrowly because it is very specific language to say the board itself in these meetings or the board chair can give an assignment to a committee. And that committee will go in depth into that issue and may come back and present what they find. But I don't read that as the committee saying, hey, let's talk about these 5 things without the board or the board chair saying, look, give us a more in-depth review of this and what you guys think about that, what you see out there. So it sounds like we have just some, and you can interpret, I know we can all interpret it differently, but that's how I interpret it. I think probably, I understand where it reads here, the intent or the purpose, and maybe there was some historical purpose when these bylaws were first drafted. I don't know if that still exists. But
Okay, how we've interpreted it in the past. Jonathan, what's the number of that provision about the local mental health boards that was passed, 3 or 4 years ago?
The bill number? The bill number?
Yeah,
I can't remember.
okay, well, anyway, we had a bill before the legislature 3 or 4 years ago that was going to change the duties of local mental health boards to include a variety of things, and that we were to be provided with staff and theoretically a budget and a number of other things that the state now has in place for us to do. While the bill was pending, and I'm sorry, I cannot remember the numbers. While that bill was pending, we had a lot of discussion about whether we in fact could have the person power to do some of the things that were in that act. You remember, Jonathan? So, for example, we're supposed to, the local mental health board was supposed to review staffing and make recommendations to the department well, we don't have a position on that because we don't know what staff exists and what staff doesn't exist already. And and as volunteers, that's not something that I feel particularly strongly about us spending our time to do. So we talked about it and we kicked around about whether we'd have enough resources to do that. And I believe that the state mental health organization, the board,
Advisory board.
the advisory board took a position of do not support for the bill. It passed anyway, but I mean, that's the kind of thing we might want to put a red flag on, to say, we don't really have we feel we don't really have the resources to do this. Should this be something that we take to another level? We bring that to the board would then say, okay, we need to notify the board of supervisors about this pending legislation and that we don't have X, Y, or Z. And we then take a collective board vote on it, and it would either go to the board of supervisors or it wouldn't. Because in all instances, yes, the committee advises the board, the local mental health board, but this board advises the board of supervisors. So I think the membership and the chair have the responsibility to look at something and see if it rises to the level that needs to be shared with the board. And I don't expect necessarily the committee to know specifically that there are issues with the budget or not with the budget, because I think this standing committee really has the responsibility to bring that to the board, to the local mental health board.
Yeah, no, that all makes perfect sense. This isn't the only board that I sit on, but I would say that given the limited experience I have as a new person coming in and expected to be versed in this, it wasn't clear to me, based on your experience and lived experience having served on the board, that that's what the
That's what
oriented
it
actions
means.
entail.
I understand that.
Yeah.
I'm telling you what the past interpretation has been. That doesn't say that we cannot change it or that we cannot make it more explicit so that happens. So for example, there's a Mental Health Services Act budget that gets updated every year.
Sure.
I would think that it would be the duty of the standing Budget and Finance Committee to review that and let the board know if there's something that needs to be paid attention to it. I wouldn't wait for the board, for the local mental health board to ask us if there's something.
And so respectfully, I appreciate that
Okay.
position. But as I review this, I see it a little differently. And I see it as if there's something that anybody in this group sees out there that they think that the committee should look a little closer at, they should bring it to the group. And the group can vote on it and assign it to the subcommittee, or the chair can just take action and assign it to the subcommittee, as opposed to us are looking for things that I don't mean to sound like arbitrarily, to bring to those committees. I think that could be a resource training. I don't know how that would look.
Well, I think there are issues that we know we're gonna wanna stay on top of and monitor. But I do think it's good for the board and board chair to know what the committees are working on, so they don't spin their wheels and come back and have the board say, that's not something we care that much about. So I think like there are certain things that we know we're gonna want on our radar, like what you were talking
The
about.
MHSA, yeah.
So I'm not disagreeing that the committee should not look at stuff. I'm just saying the process, I'm a process, and the process should be organized. The process should come through this, I think the process should come through this board before it's assigned to the committee. And the board can say, whatever committee, this is an area that we'd like you guys to meet, talk about, give us some input on after your discussion or research. Because we could end up with quite a few items that we're just arbitrarily bringing stuff together. We
No,
could.
not if it was
In
budget.
In theory,
That's a-
we could.
Yeah, I mean, there's standing things that we have on our plate. And that is has been one of them.
And I think that where some people are unclear is what those standing things are, and especially the newer people, what are the important issues? So for you, you've been around for a little while, so you know what the important issues are, So I think there should be communication. So, Christy?
What I'm hearing is that a member of the board is asking for refinement to the actual language that is in this section 13. And I agree. I think it can be more explicitly written where it's made more clear, not just for the members, but for the public. My suggestion would be to include some language from the California Association of Local Behavioral Health Boards, include things like, as referenced in California Welfare and Institution Code 5604.2A, which cover mental health related duties. So, this reflects the October 2019 California legislative update. So I think we can get more concise in this language. And that's what I'm hearing, is that there's a request to make the language in our bylaws more concise to help direct the work.
How specific do we really want to get in the bylaws? So when you start talking about the duties,
Referencing, what I'm talking about is referencing the actual welfare and institution code in our language.
okay, so not listing out the duties, but just saying as laid out in the code. And then how would that work? Because what I'm seeing I'm seeing that since all the committees report out at every meeting, they would be saying, this is what we did and this is what we'd like to do going forward. And so we would have opportunities as a board to weigh in on it anyway. But what I'm concerned about is if we're just referring to the code, and I'm assuming that the code is fairly broad, then wouldn't that give the committees a lot of room to maybe go off in a different direction?
I think the code is actually, it's pretty concise, without being so detailed on what they can and can't do. We do reference the welfare and institution code in other parts of the bylaws. I just think that there is an opportunity for some refinement here. And I think if we reference back to the code, I think it would help because it lists out, the duties.
Okay.
So I actually think the language is pretty specific.
Yeah.
It doesn't prevent anything to come before these committees that the board or the chair thinks should come before these committees. And I'm not eliminating anything. I'm not saying we eliminate anything from consideration. I'm just saying the process seems pretty specific. That anybody can come here and if he has historical knowledge of some of the things they look at, and she may say, hey, I think that this committee should look at A, B, and C. And the board we could talk about it in a meeting and everybody can agree, and then that committee now has a mandate to go look at those issues for the board, whatever that may be, whatever the board wants. So I think the language is pretty clear to get anything in there for review. I don't know if I'm just seeing that differently. I just am looking at process, and I like the process that's written. I know some folks may disagree with that. I like the process that the board or the chair decides what those issues are.
Well, what I'm hearing Dee say is that in her experience, the board chair and the board have not issued any tasks. They haven't assigned anything.
Well, then that's what we need to be doing in the
That-
report.
yeah.
I think she was just asking, I think they were just asking for clarification. Is that what it means? Not that they're not having assigned anything, because these committees haven't met until recently in quite some time. So we're really just ramping this thing up again, right? So I think as we start meeting, more things will be asked of these committees. And we'll get there. But I heard that you were just asking for clarification on that, right?
Yeah, because plainly written, it does seem that way, that we would be tasked through the board and or chair what those actions entail and go forward and do. And I think Nikki provided a perfect example, the MHSA budget. That's a binding document that's gonna govern what that committee looks at, identifies, flags, and reports back to the board. So that's kind of what I was wondering for our program and our communication and education. Is there something out there that exists that would equally serve as, when all else fails, Jonathan and or this respective platform don't have any specific tasks that fall out of our formal meetings, what is it that we can still, prioritize and focus on to continue moving the needle?
I think you have put your finger on exactly what has been the stumbling block for the program committee in the past. I don't think it applies as much to the budget and finance committee because we know that the budget's gonna happen every year.
Yeah.
I don't wanna have to sit here personally and wait for the board to say, oh, yeah, there's a budget out, because it is not only our responsibility to do this, it's our responsibility to do it in a timely enough fashion that the board can act on it. And if at one meeting, let's say the May meeting, the board says, we need to get the Budget and Finance Committee to look at this. Well, then we don't do it until June. Maybe we missed the June meeting since we're meeting earlier in the month now. We might not get to it in time for the board to act on it, in time for us to make recommendation to the Board of Supervisors. But since we clearly know that this is something that happens every year, there shouldn't be a need for us to have to be tasked with it by the board. That's all I'm saying. And I don't, but I think you're absolutely right with respect to both communications and education and program, because those things are episodic.
But Nikki, you wouldn't actually have to wait for the next meeting, right? Because if the board chair can task, there's no reason the chair has to wait for the next meeting, is there?
I mean, those standing issues could be brought forth several months before, right? I mean, because you have the historical knowledge and knows our Jonathan probably has some of that.
Yeah.
I also, one of the things that concerns me is that I don't think the chair, the committee should be, as I said, if we could be doing duplicative work, that the greater board should be hearing. In other words, am I going to monopolize staff's time to give us a presentation on a budget issue that is going to be given to the entire board the next month? Unless there's an issue that we need to report back to you folks on, a specific issue with that budget item, whatever it may be. And that's why the guidance of the board and the guidance of the chair to look at an issue and maybe something specific within that issue, I think is important to have a sort of roadmap for the committee, whatever committee it is.
Jonathan, we had before, years before, I think, had a question in regards to, which would help us to determine if something was actually working efficiently with the measurements, right?
Yeah, metrics, right, that's right.
Right, and we weren't getting those, so we couldn't tell if a certain program was actually being effective, and we thought that, why don't we have these measures? That's something that we could go back into and look at some of the data from that so that we see how we can make recommendations to the board to be able to get that information in a timely fashion for us to be able to, when we look at our 3-year plans that we get, because we get them last minute, and we're asked to read the entire three-year plan and make recommendations or, whatever we think on that plan to the board. And a lot of times we didn't have all the information in front of us. And besides that, I think it has to get in at a certain time. And so we really, last time we were asking for more time to read it. And they gave us a little bit more time, but it's still, even if you do have a little bit more time to read, you don't have all that information in front of you that you can actually use to make a suggestion to the supervisors because we don't have all the data. So that's something I think that we could have used in education, communication education, or budgeting committees that might make some good suggestions to the supervisors to be more effective.
Well, and so I'm just going to give a little historical perspective on that. For many, many, many years, we have not had the outcome measures for all the different programs that are receiving funding under the Mental Health Services Act. And there are a whole host of reasons why we haven't received that information. And it's difficult, as you said, to assess without seeing data. And I know that that's something, one of many, many things that Carlene is focusing on. I don't know if you want to comment on where we're at on trying to provide the resources that you haven't had in the past to be able to get that data.
Yeah, thank you. Carlene Tchaikovsky with the Health and Human Services Agency. We historically, many years ago, as you know, there weren't generally weren't outcomes being tracked, right? And several years ago, the Health and Human Services Agency adopted a model of results-based accountability model. So you'll hear us refer to that as RBAs. That is a way to measure outcomes, right? It is not robust program evaluation, so I want to be clear, right? It is not the kind of programmatic evaluation that will tell you if this program is as effective as a similar program in another county or another state. But it will tell us information about the data, the metrics that we've selected, right, for each of the programs. And so we've come a really long way and we still have a lot of work to do. At this point though, we do not enter into a contract with a provider without having an RBA, a results-based accountability measure attached to that contract. So anytime we execute a contract for services, that program will have RBAs attached to it. Where we've not caught up is with our own internal programs within the Health and Human Services Agency. And there are many reasons for that, as Jonathan said. Part of it is that historically, we've not prioritized the infrastructure that we need, right, in order to have enough staffing resources and internal resources to develop the measures, track the data, report on the outcomes, and to put it oversimplify it, we've really prioritized putting the majority of our funding into hiring staff who are providing direct services to the community, which is very important. And we also need to measure the outcomes. We need to track data. We need to have the infrastructure to manage the contracts and to manage all of the requirements from the state. And so we're playing catch up and we're still very far away. Sam and I were looking at the adult and aging organizational chart and how few positions are really focused on helping develop and implement programs or develop outcomes and track those things. So it's something that we're working on as an organization. And it's difficult. We're heading into a budget year at the state that we're being told it's not looking great, right? And so we're having a lean budget year for HHSA looking into next fiscal year. So we've also tried contracting with organizations to help us build better evaluation measures. That wasn't super successful, to be frank. And so we have to go back to the drawing board there and probably look for another approach to building more robust evaluation measures for particular, what we would consider high priority programs, crisis, full service partnerships, our K through 12 school partnerships project for the youth side of things. And so we're working on a plan for that now. So I think the most recent MHSA 3-year plan included outcomes for many of the programs, but there were some that were missing. And even for some that had partial outcomes, we had data points that were missing. We have major deficits with our electronic health records. So I can go on and on about the challenges. The reality is that we understand how critically important it is. And it's critically important for us. And listening to the conversation here today, having that data is really important for you all in order to do the roles that you've signed up for, to provide the service that you've committed to providing as part of the local mental health board. And so we certainly want to set you up for success with that and to ensure that you have the information you need. So I do think it's gotten better. I think we haven't had the subcommittees, right, really running. And so I would suspect that if you wanted to start reviewing data now, we certainly do have outcomes for that could be reviewed across many programs. Like I said, every contracted service has RBAs and those outcomes are being reported quarterly and annually. And we're working on our internal ones. We have many, but we still have several programs that need RBAs developed for our internal programs.
Right, so we're being asked to participate on subcommittees and to give input to the supervisors. So if we're asked to participate in doing this, to take on another role other than being on the mental health board, that would help us to be able to give that a helpful report to the supervisors. So, and it sounds to me that, and we are, because I've been here for a little bit, moving forward in that direction is to get those measurements and to get them a little earlier too. But this is something that we could do on a subcommittee to look into before we get into that position, to be able to make a report, not just to the supervisors, but to the board too. So we can make better decisions when we're going through that stuff, on bequest, of course.
Of all of us.
So our chairperson.
Yeah, so
Maybe I misunderstood that.
The subcommittees aren't reporting directly to the supervisors.
Right.
The subcommittees are reporting to this board.
Correct.
Board, right.
Okay,
Right,
so
right.
I think we've had some really good points made, really good points all across. So what I'd like to do is, because these committees have not been operational for quite some time, I understand how there's a little lack of clarity and uncertainty and a little confusion too. I would like to just move forward. We can start today with each of the reports in terms of what each committee is doing or what the board feels they would like the committee to do. And then I think if down the road, after seeing how that goes, we feel we need to make some amendments to the bylaws regarding the duties of the committees, we can always do that down the road. Okay.
Just a quick question,
yes.
is that in collaboration with HH?
Is what?
Well, because you're gonna have the outcomes, which
Yes.
inherently is the data that's gonna drive the decisions.
Yes.
Those decisions inherently coming from said standing committees through discussion and dialogue and input from the board, so.
Recommendations, right? I mean, that would drive the recommendations,
Your
right?
recommendations, yeah, not
Yeah,
decisions.
yeah.
Who am I?
Yeah.
So it would seem like, because we're in the infancy stages of resurrecting the standing committees, it almost seems like the chairs of each committee would benefit from having almost like a reintroduction to how these committees are expected to perform and where we should be leveraging this information. I don't think that, and I don't think I heard that from you, but I just want to make sure that that point isn't missed, because I think absent doing that to set the tone until we get more mature in our RBAs or what have you, then we'll still be kind of floundering.
I agree.
So should the action item be to be able to have a conjoined presentation from HHA and or you that come to the standing committees and kind of lay that out
In terms of the outcome measures,
in terms of the priorities of this board
I think we
in the
can,
various.
I think we can, what I suggest is that we set the priorities at these meetings.
Okay.
So like right now,
Just as the bylaws.
we're doing
read.
budget and finance. I don't know if Joe has some thoughts of what he might like to do, or the committee, but I know that
Gotcha.
this board, and especially Nikki, since she's been on that committee and is on it now, might have, some suggestions about what their focus should be.
Okay, and so then based on that, we're saying that the way that these bylaws read is correct.
So
That
the way
their
that,
tasks will be directed by the chair and or the board chair.
or the board, chair or the board.
Okay,
Yeah.
gotcha.
Yes,
So that would mean that you could make a recommendations to the chair and discuss it amongst us, and if it's something that we only find that it's important, we can look into it as a committee.
yes, so it reads the board chair and or the board. So it doesn't, it's not like everything's coming from the chair. It's the chair and or the board.
Yeah, like I have an example, like we have a program right now that we implemented in Yolo County, which has the billboards, and the little lawn signs and things like that that are being put out, and people are saying, what is that? That to me is more of an education and a communication. Is that effective? Is that being effective? What kind of questions are we getting back on that? Well, as a board, we probably wouldn't be able to, but as a subcommittee, we can go back, research that, come back with that information and give it and say, is this something we want to still continue? Is it really worth, is it the money being used effectively by messaging that way, or should we think about doing it in another way? And that also has the measurements, where you have to look at the measurements too, if there are any, because it's something new, right?
Yeah, that one's no longer, that particular project was sunset, it was time limited and it's done, but yeah.
How
I mean,
effective was it?
right, it should, yeah, right, and well, and
Did we
I
spend
didn't
our
create,
money wisely?
I didn't create the program, so I didn't create the measurements for it, but And I wasn't a part
I don't
of,
wanna
I
put you
wasn't
on the
part of it,
spot.
no, it's okay, I
I'm
wasn't
not
part of
putting you
the
on the spot.
discussion.
Disclaimer.
Yeah. I'm new here, just kidding. I
I'm
can't say that
just
anymore.
curious, that's all.
I can't say that anymore.
We got a little nervous about the efficiency of that disclaimer.
I'm just kidding. No, what he's talking about was a hot topic. This predates your time, but it was a hot topic at many local mental health board meetings. But no, I'm just, yeah, what you're saying is right, right? And I think that, and I think the local mental health board has specific roles around recommendations specifically related to Mental Health Services Act funding and some other, and so I do see it as our responsibility to make sure that you have the information that you need, and I can't create things that don't exist,
I
right?
know you
So I
just
can
came
only-
in too,
I-
so.
Well, thank you for giving me that grace. I don't think I get that anymore, but, so we certainly, to whatever extent you want us to participate in this, or, come bring information or just provide the information, just let us know. That's our
Thank
job,
you.
yeah.
So if we wanted to request data, we would just go through the board chair to request that data,
Yeah,
chair to chair.
Okay, so let's go to standing committees.
Wait, can we finish this up? So are we gonna continue this item to next month meeting?
We are going to continue because regardless of the discussion we've just had, there are going to be some edits.
It's just for consensus says we want to keep it the way it is, where the chair appoints people to the standing committees and the chair and or the board can be tasked to the standing committees. That's how I read it. We don't want to make any changes.
For now, yes.
For now,
Yeah.
okay.
Can
Okay.
I ask another bylaws related question?
Yes.
With the board self-evaluation, where it says each year we're supposed to conduct a board self-evaluation, are we going to conduct a board self-evaluation or is there like a time?
Didn't we discuss at a past
It's
meeting?
been almost 10 years that I've been on the board and I've never,
But now there's a
Never
Google
really-
form. All you have to do is click on the Google form and fill it out.
I mean, I understand. I'm just saying, I have nothing to add historically on this point.
There's a form, yeah.
Yeah.
You should set that deadline.
Is that something we do as a board or is that something individual members do to assess how effective the board is or?
I'm not sure because it's been so long since it's been done.
Oh, that goes subcommittee.
I haven't seen the form, but I think just on other committees, we have something similar and it's each individual completes it and then someone like Christina, would compile the results and then share, usually then they're sort of discussed as a membership.
Okay.
Well, I like to mention that you put that on a meeting agenda, that we could, as a board, complete that task at some point this year.
As a board or as individuals? I
Each
mean, individual
individual, when we get 15 members, maybe we can do it then.
Okay, then we can compile it. That's what you mean.
Yeah, when we get 15
Okay,
people on the board,
okay,
that's my recommendation.
all right. Can we put that on the agenda, Christina? The
For next
self-evaluation
month,
Yeah.
future month, or on the month after we're
Ongoing.
full?
next month,
At least to discuss it.
so we can discuss it. All right, anything else on bylaws?
Thank you for everything.
Oh, yeah, thank you. Thank you. Okay. Budget and finance, so.
Yes, sir. Put my notes back. So budget and finance has not met.
Right,
I specifically have not met because I do, clearly we have some varying opinions on the mandate of these subcommittees, and I really want to have that discussion. But we will meet, it will probably be an open agenda, just to discuss maybe some of the traditional things that folks have historical knowledge of, that this committee may want to look at. And those ideas, I think, will be brought back to the board for discussion on whether or not we can look at it. I think I have concerns that we gotta be looking at things that really that bring value to decisions this board's gonna make, otherwise we're just wasting people's time. And that's really hard to, probably has some historical knowledge there, it's probably hard for us to decide. Which is why I like the idea of bringing those issues before we get into deep discussion to this group to decide if you want to give that to us to look at.
Okay.
And I think we're gonna have to have some input from staff on it as well, because if these are decisions that are not, these are issues that are not under our purview, or issues that this board, that we may not report out on. I don't want to spin our wheels looking at those issues as well, or waste their time pulling statistics that are really not going to serve us a purpose. So I think that's my opinion on how that committee will move forward. And will likely bring things to this group for your input and decision on whether or not we should be looking at it. Because I go back to, if we put 3 or 4 or 5 or 6 issues, that's going to be a significant amount of people's time to look at those issues appropriately, research them, review them, write a report and bring it to you folks. So I think it really has to be something of great value to this group before we really dive deep into those things.
And for those of you new or those that forgot, at a certain point in time, we were uncertain whether we would keep the budget committee as a standing committee, and that's one of the reasons why the committee has not met. And then we decided as a board last meeting to keep the budget and finance committee. So did you have a comment, Nikki?
Yes, just occurred to me, because we are in a new day, since the committees have met regularly. We used to have, quite often what we would do is we would have a board meeting, a local mental health board meeting for an hour, and we would let the committees meet for an hour of the time that we had for the local mental health board meeting each month. I'd like to suggest that we ask that the committees meet virtually so that we wouldn't need to dig into board time for them. And so that we would, in fact, have a report to present to the board if there was something the committee had done.
Can that be, is that a Brown Act issue? I know that there's certain Brown Act requirements, but in terms of meetings,
We've been doing that.
you've been meeting virtual?
Yeah, and posting it and following Brown Act.
Yeah, I'm just wondering, like, we can't meet virtually.
No, we can't,
So
but the
the committees
committees, I
can.
think, could, and we,
Okay.
and,
Because they're not
but
brown out.
it hasn't
Well,
been.
they are.
They are.
They are
Standing
Brown.
committees are.
Standing
Yeah,
committees are
standing.
Brown Act.
Standing, yes,
They are Brown Act,
standing, yeah.
but are they treated the same as this?
We would have to notice Christina. Christina would need to notice.
Right, and they've been doing that.
Yeah.
They've been
Right,
doing that.
That's all I'm saying.
My question is like this board, which has Brown Act requirements, do they need to meet in person? I don't know the answer to that.
Yeah, I don't
Oh,
know the answer either.
That's what we discussed.
Yeah, I think we probably need county council
I'll ask
Mhm.
Phil.
because the bill that allowed virtual during the
Right.
pandemic was
Last.
scaled way back. It was scaled way backward. Now, if only under an emergency situation can a board member.
Right.
Yeah.
Right, okay, I'll ask Phil. Go ahead, on budget.
Yeah, budget and finance, as a committee member, I really just want to reiterate what Ms. King said last meeting. I really appreciated the knowledge as far as your reference to how the budget and finance committee used to meet biannually around the fiscal budget periods. And that they met with the county budget staff and was able to collect and meet and collaborate
Right.
that way. So I would like to see that continue.
Okay. All right. Communications and education.
Yeah, so, I understand it was announced when I was not here, though I let you know via email that I am the chair of this, committee. I think what's most important for me to lead my committee effectively is to be explicitly clear on what those
Right.
objectives will entail. So as of right now, if you were asking me on the spot, as far as frequency, it goes, I'd like to meet quarterly. I think to Joe's point, I think that he kind of spelled out all the things I was thinking, stated a lot better. It, you know, folks are involved in a lot. We need to be mindful of the bandwidth in which we're all expected to be involved. And I think that to me seems fine for now, but once, you know, we have actual tangible tasks to focus on, then we can revisit that.
And that's something that Carly and I have talked about a little bit in terms of staffing and providing support.
Mhm.
Say something about that.
Yeah, let's say it, because what are we talking about?
Yeah, I mean, so just to level set, you know, Christina provides some staffing support to the local mental health board, and her full-time job is supporting the entire adult and aging branch, which has about 200 employees, and a whole lot going on. And she's also Samantha's assistant. And so to say she has a full plate would be gross understatement. And Jonathan and I have exchanged some emails over time about how we can lend some additional, support from the agency. And so, I mean, I'm happy to share some things here. I also would like to have just a conversation with you and perhaps the vice chair, just about brainstorming some options. But I think that my humble suggestion would be that there would probably be a benefit to having more of an analyst, some additional analyst type support around the annual report, around, some of the data notebook that needs to be completed, by the board. And even having someone who could be not to take some of the pressure off of Christina, but to have someone who could be that liaison to like gathering all of the RBAs to get it to the program committee, or gathering whatever financial documents are needed for the finance committee, and lending some additional support. So we also need to do some brainstorming about like who could take that on. Are we talking about additional staffing, and some of those things. I have some ideas around some folks who might have some time, who have more specialized roles and could lend some assistance. But I obviously want to talk about that a little bit more and make sure that we find a good fit. Christina does so much with, so much else on her plate. And I think the behavioral health is evolving. It means that your roles are evolving. There's so much more happening all the time. And so I think we have to re-look at how much support we're providing in terms of the staffing support. And I think we might want to layer on some additional support to the board. So,
To that end, I would
Okay.
About.
I would recommend we consider who from the committees contacts staff for specific information. I mean, you probably don't want 15 emails come in for what could be the same thing from 3 different committee members, right? So,
Probably the chairs.
something to think about.
yeah.
Maybe we can discuss that unless everybody's in agreement, then it'll be the chair that will reach out to staff for information. That way we're not inundating you with
Thank you.
emails.
Yeah, but we want, it's like Jonathan exchanged an email where we were looking at, Christina pulled up all of the requirements, right, of the Lackawanna Health Board and what's supposed to be done. It's like, you're only gonna be able to be successful doing that with some additional support from us, because so much of it comes from information that you need from us. And I think some additional support, we recognize you're all volunteers, volunteering your time. And so I'm really open to increasing the support that we're like I said, layering on some additional support to help you all to be successful. You're doing a lot right now.
Okay. Program?
Hi, Christy Correa, Program Chair. We've been meeting virtually on the first Wednesday of every month, and we're going to switch to first Monday, I believe, if that works. We were hoping to confirm with Brad that he's been sick, just because this meeting probably will fall on a Wednesday and we just want to stay out of the way. So with that being said, I'll just give a quick update. We've met twice, December and January 3rd. And we are talking, we kind of review our scope, which is in our bylaws. The program committee shall provide leadership to the board, this board, on the review and evaluation of Yolo County mental health needs, facilities, services, and special programs required by the Welfare and Institution Code and Yolo County Ordinance. So we try to remember that going into this and, doing our best to find ways to evaluate the programs that are going on in each of the communities. We have a good mixed representation of West Sacramento members and Davis members and Woodland members. And currently it's Dee and Sarah Gaines has joined and Brad. So you have the meeting update, and basically what we would like to do is make the recommendation to create an ad hoc committee for site visits during 2024. We feel like it's important. And we've come up with a proposed list that this board can decide on where we would like to conduct site visits and include this as part of our 2024 local mental health board strategic plan. So you have the list there. So if this board would like to entertain that motion to create an ad hoc committee just to coordinate site visits And we can bring that back for discussion, next meeting, if you would like, on where you think this board should visit. We have some suggestions, we're open to other suggestions, but we would like that, to be something that we can commence, hopefully by next month.
So are you saying for the entire board to visit?
Yes, if they would like.
Oh, so.
It's an invitation.
Beyond the committee. You would
Beyond,
invite,
yes, this board.
no, I was gonna suggest that, so that's what you want to do.
Yeah, but create an ad hoc committee that could organize it and take a poll of this whole board, 15 members hopefully in February, who would like to go where. And then once we can narrow down our targets of where we want to visit, coordinate that with everyone's schedule and say, okay, we're going to go to Pine Tree Gardens in March, which dates work, and coordinate that with Pine Tree Gardens and work out some sort of logistics. So we
And so
would
would-
need an ad hoc committee to help pull that off.
Would the ad hoc committee be comprised of the committee members, or,
It could be anyone who feels like they want to help
I mean, couldn't that be
coordinate. If we
a
could,
standing committee? doing that?
yeah, it will probably end up being one member of our committee. But I don't want to, if someone really wants to like jump in, like if let's just say hypothetically, an example, if Robin wanted to get involved and she's not technically on our standing committee, I would let her help with the ad hoc committee. Like it's going to be standalone. It's just for coordination of site visits.
Yeah, my only question is, do we need another committee to do this? Is it necessary?
I prefer to have the program committee take on that responsibility and be tasked by the board to do it, as opposed to creating another ad hoc committee.
We could. I just wanted to open it up and I didn't want to I wanted to be inclusive, that's all.
So with that type of site visit, it'd just be an informational visit. There's no reporting function, no evaluation function of the group, right? We would just be going to.
Well, our task as a program committee is to evaluate, so it would give us more of an evaluation ability once we're there.
Evaluating and then reporting to the board.
It would be open to this whole board, all 15 members, so we would be collecting data, just from visiting, and that would probably go into our annual report.
What data would be collected? Is there going to be a sheet of data points for all places we're going, or is there going to be general impressions, or?
Well,
It's
those-
pretty broad, huh?
Those
Yeah,
are
no, I'm just kind of.
So generally, when you do facility visits, and I've seen facility visits at other types of institutions or facilities, there is for boards, you put together a sheet of the things you're going to look at, and evaluate regularly, because if you're getting evaluated, you're probably gonna make recommendations that they need to fix, or they don't need to fix, and you want to be able to reevaluate those key program areas.
Well, that's something we could look at if that's a recommendation, but we're following, what it says in our bylaws, where we review and evaluation of Yolo County mental health needs, facilities, and services. So if we aren't experiencing what the facilities are, then we don't have, the information that we need. So this is our compass.
This is something that I was actually really excited about when I was still on the programs committee. And the reason I got excited about it was because so many other local mental health boards do these visits. And I thought it was strange that we hadn't been. So what we could do is reach out to the other local mental health boards and ask them, well, what do you do on your visits? And, get their.
We had done
That's a
some.
good idea,
And
Before I got here.
before you got here,
pandemic,
and
so-
before COVID, more importantly, before COVID got here.
Yeah.
We had visited, the farmhouse, and we visited, Safe Harbor. At one point, this was while we still had kind of a standing relationship with State Harbor for a fixed number of beds. But,
We still have that.
yeah, well, but it's gonna be tweaked, right?
No,
That's actually,
No? Okay, well, I guess I didn't
it's a change
understand.
in a positive way.
We're changing it, okay.
we got
So-
more beds.
So,
More beds.
Yeah.
more beds.
There's more beds.
Okay, so at any rate, it gave us more information than the individual point in time censuses that we got about how the beds were occupied and how they've been occupied, and you talk to the staff member there about what the situation is, what makes it difficult for them to get their job done, what are the positive things that help them get their job done. So you're providing background information that tells you more than just the numbers on the page tell you.
I think this is really valuable, and I think
Me
someone that might be able to assist us with this is Teresa Comstock, who's our executive director for our statewide association. And she's actually coming next month. She'll be on the agenda. I've asked her to come to talk for about an hour of what the roles of board members and the committees, and that's something that we certainly could be asking her. And I bet she'd have some samples of worksheets in terms of guidance on going and doing site visits. So I think it's great that we're now working on doing that.
So if we want to reach out ahead of time and ask questions, so when she comes, she's prepared to answer that question, we could with our chairs to the subcommittees.
If you email me, any of you can email me questions that you want addressed from her. That'll, I'm sure she'd appreciate that. So she's going to be doing it virtually.
Oh, okay, great.
She lives in, I think, Napa.
Will be.
I think as the program chair, I will, I can find some resources and reach out and see what other
Okay.
local mental health boards are using and use the Cal Association as a resource also. So what I'm hearing is we don't want an ad hoc committee, we want program committee to do it.
Well, I think I do want to wait and hear what other people are doing and whether they've found it better to do. I mean,
Well, it's our decision, so.
no, but I mean, have they found that it's really, works a lot better to have an ad hoc committee just focusing on this one project, or have they found that it's better for the programs committee to just do it?
Well, it was my recommendation because I wanted to be inclusive, like for you and Robin and things like that. But if this board doesn't want to do that, if there's not, a vote and we want to just have the program committee do that, I'm fine with that. I just don't want to stall it.
I think what some of us are saying is, I think it's great that you're being inclusive, but I don't know that you need an ad hoc committee to be inclusive.
Okay, well, let's make a decision. Like,
So I think that others could participate,
Mhm.
but I don't think we need an ad hoc committee to do that.
I'd be interested in participating. What's the mechanism for me to do that? If we're, okay, so just
I think
help.
the standing committees are open to the entire membership of the
Right.
board to
Anyone can
attend
help with standing committee.
if they're interested in it. So if there's program committee is gonna have a meeting, and one of the topics gonna be site visits, and that's put out to the board, any board member who wants to participate in that can join that meeting. I've, as part of the mental health court team, I've been to 3B North and the other two, Safe Harbor, Farmhouse, they're all.
The jail.
The jail too, yes. And for me, it's all education. We talk about these places, but actually go and visit and see what they are and how they operate kind of gives me more perspective on what they're doing. And it's not so much getting an evaluation, it's just kind of getting information so I have a better understanding. So I was asking that question, as opposed to, are we doing a checklist, or is it informational for the board members to see how that's what the key parts for our mental health services in the county actually operate. So that's kind of what my question was.
So I agree with you. Those are two entirely different propositions.
Yeah, so what
An
is,
informational is one thing, and an evaluation is a formal process that really, any type of document that comes out of that before it's even sent out there should go to the whole board. And I don't know, I'm sure there are all types of evaluations of some of these facilities. So if it doesn't want to be people do it, but I know I'm getting way ahead of the cart to put horse there. But to me, those are two entirely different propositions.
I agree, and if we're going to have an informational visit, or if it's going to be evaluation, there needs to be something, criteria we're evaluating. And so
Well-
if I think the program standing committee wants to develop either an evaluation or focus on informational visits, the program committee can take the lead in developing that, and report back on what the proposal is, and for any members of the board who want to participate in that, you can send an email out with a time when that's going to be discussed for those who aren't on the standing committee want to engage.
Okay, well, since it says evaluation in our bylaws for the program committee, what I'm gonna suggest is that we put site visits on as an agenda item And then what we will do as a program committee is, we have this list of proposed sites, most of them are facilities. And then we can discuss them and vote on them next meeting, and we can come up with an evaluation, how we are going to perform our duty of review and evaluation of a Yolo County facility and service. And we can bring that to this board, and we can decide how we want to move forward.
So these sites, these site visits, the ones that you have proposed visits, those are mainly Yolo County run or
No.
private owned too?
Contracted.
Contracted?
HHS.
Okay, people who have contracts with Yolo County to provide services.
Our money, yeah.
Would that include in West Sacramento, the Recovery Cafe?
No.
No?
No.
Okay, because that is a place that they,
They get some American Recovery Act funding.
Some homelessness funding, but
Yeah,
no
but not-
HSA funding.
okay. Just checking what kind of places that we were talking about.
And
Beaver
we
Street
could
wouldn't be
visit there.
included either?
It's in the community. I mean, we're open to suggestion, like there's no right or wrong. I think we just need to figure out as a board how we want to pull it off.
Yeah, no, my reasoning for that was to see if there was anything that we can do to help provide so that they would be able to be even more efficient than what the job that they're already doing in the communities. Because our thing is what we want to do is improve the services that Yolo County has. So if there's a way that we can improve, we can do it.
So just a process question, because this can apply to any committee that develops an evaluation of something. Is there a supervisor board review of that document? And is there a legal review of that document? Because it sounds like we're going to be giving opinions on programs in an official public document. And we all know that those can be used in a variety of different ways. So when we develop a form with questions on that, what is the review process for that? And we may not answer it today, but it's something I think we should think about.
The review process for developing the form or the review process for
let's
how
say
we answer the form?
For approval of use of that form. So let's say we have a form with 15 questions on it. Some of those questions could be critical of a program, and that is a county document that could be used in any type of litigation moving forward. Our names are on it, and so there has to be some sort of review of the document that we put together.
Okay. All right, item 8, the 2024 calendar. As you can see, Christina put together this calendar. Thank you, Christina. Based on our discussions, we're looking at meeting the first Wednesday instead of the first Monday, which is challenging for our Board of Supervisor liaisons and also those that go to the board meetings on the first Tuesday of each month. So does everyone have the proposed schedule, and does anyone have any issues with it? Okay, let's then
So the
Vote on
first
it.
Wednesday,
first Wednesday.
it's the last.
We at one point talked about the last Wednesday, and then there was an issue with our emails were talking about, and I said it's actually the first Wednesday. But I can't remember why. There was a reason why the last Wednesday, maybe because there were,
Because we were meeting after the last board meeting of the month.
Okay.
I think that was the issue.
Okay.
The
Anyway.
issue was for us to meet in time to, if we had something to report to the board, it could go to them in one of their meetings that month.
right. So then I'll entertain a motion.
Has this board traditionally met 10 times a year?
I think it's 10 times, yeah.
Okay. So it's-
Yeah, I think it's, yeah. We take off, what, November and December? No,
August and November.
August and November.
That's what I said.
August and November, thanks.
Can I just make one note? This is like, sorry, but on our webpage, it says, and one rural city. So can we either take that off or do it, but not be inconsistent in our messaging?
I think it's important for us to do it, and we had been doing it up until COVID. We met in Winters, we proposed meeting in Esparto, but I don't think we had I don't think they had a public
Yeah,
location.
we met in
It was a
the
library.
We met in the
Oh,
Spartan.
yes, okay, we
Yeah.
met in the house.
So the bylaws say one meeting in West Sac, one in Davis. The website says one in a rural area. And what we had been doing is we had been rotating it every single meeting,
Right.
okay?
Yes.
So having done the rotations, that didn't seem to make a lot of sense to me, having done that, because we got very little participation in person. That's pre-COVID, pre-virtual. And my feeling is certainly the bylaws make sense doing one meeting in Davis, one meeting in West Sac. I personally don't think it makes logistical sense to be rotating every single meeting between West Sac, Davis, Woodland, and Esparto. But if we wanted to add a third location once a year to have a physical meeting in, which could be in the unincorporated area, if that's what the board wants to do, we can do that and then make sure that the website is consistent. So I don't know if anyone has any thoughts on that, or if we want to keep it to what the bylaws say and fix the website, or add one visit to the unincorporated. Nikki?
Again, a contrarian. I think it's important to have more than one meeting in the various communities. Because it kind of equalizes the burden on our public members who come.
They don't come though.
Yeah. Well, we have.
They don't come, in my experience, for a couple of years, we get like one, I'm not talking about Woodland, and I'm not talking about now. So I'm talking about when we go to Esparto, we have one person.
You're
When
right.
we go to West Sac, we have 0, or we have 1. When we go to Davis, we have a little more than that in Davis. But to me, to go out to Esparto and have one person show up,
Yeah.
That's kind of my point, right? So that was a few years of doing that every other meeting. So
I don't have a problem with having one in the rural areas. I think we should have one in rural areas. I just think that, I don't know how much information got out into the West Sacramento community. I know that perhaps not the bulk of the NAMI members live in Davis, but a lot of them do. And they had gotten more used to coming to our meetings when they were virtual. And I think we might still have more of them come if we continue to have a rotation that goes through Davis on a more regular basis than once a year.
So my thought was, I'm all for the opportunity for people to participate, but my thought was that we were allowing for that now that we have virtual participation. So because I want people to participate, but I thought instead of going out and having 1 or 2, it's much easier. I mean, they can still do it, even if we go out there, it'll still be virtual. But so I felt like we were allowing for the participation and inclusiveness with the virtual. But I'll and then maybe we'll have some public comments on this after, because I haven't asked for public comments. What does everyone think?
I agree with what you're saying too, because from experience, when we would go out and rotate and we didn't have that much participation, but with the public, but at that time that we were doing it, we didn't have virtual. It was all in person, but now we have virtual and we seem to get a pretty good response with participation with the virtual. So if we didn't make it out to those places, like you're saying, they still have an opportunity to participate virtually, which is actually easier, because we had more participation when we had COVID through virtual than we did in person. So we're not going to lose anything. I think we'll gain. And there's only a few places, West Sac and right here, that we can actually do with the
Virtual.
No, we could find another location in Davis to do it.
We could, but I'm just saying, right now, I think we were having a problem with establishing a place that we can do.
Take that anywhere, and I was saying,
No,
Virtual.
yeah, and do we have anything like that in winter?
I don't think so.
No,
Only here.
it would,
No.
we probably don't.
So
So what you're saying is, yeah, I would
If we
agree.
do our meetings in Davis and West Sacramento, will those meetings be virtual?
yes,
Mhm.
they were
They have different equipment.
Yeah.
different equipment.
Different.
And we had
Library.
participation virtually when we were in West Sacramento. They weren't there in person, but they were there virtually.
Yeah.
So we actually gained.
If we're going to do a meeting in a rural area, and we want want to do that? Do we want that incorporated in our bylaws? And asking for it? We want to leave it vague and not include that.
Do we want? So let me start with the Wednesday meetings. Let's just sell that. Can we have a motion on having the meetings being the first Wednesday?
I move that we vote on having the meetings on the first Wednesday of the 10 months outlined in the calendar.
Do we have a second?
Second.
All in favor, say aye.
Aye.
Opposed?
Opposed.
Opposed?
Abstain.
Abstain?
I'm abstaining also.
Okay. Do you want some discussion on that?
Well, Wednesdays are just a very difficult day, but if the greater board is there, since we're gonna have some, since we're gonna be able to virtually attend, maybe.
Well, board members can't virtually attend.
It's a very difficult day, but it's the board's will, let's do it. I'll try to figure it out. I usually travel on Wednesdays.
So, I mean, we've had, and I know you weren't, like, we've had a lot of discussions and it's
I know.
so difficult to figure out, it's kind of like, nothing's perfect, but I don't, but I don't, Nikki, you had some,
I was gonna say, the other thing that came up around us rotating was that it kind of equalized the travel.
well, hang on. I want to stick to
Wednesday.
Wednesdays.
Oh,
I want to stick,
Wednesday's not a problem.
because you just said you were opposed or abstaining.
I abstain, but Wednesdays are fine.
Okay.
Listen, I know there's been a lot of discussion. I wasn't here for those meetings, and we worked through this, and that's fine. I'm gonna try to make it work as best I can, and if I don't, I'll bring it back to you. Let you know.
Or not, you get jumped in, jumped out.
I'm just, well, I needed to check to see, to make sure that it doesn't conflict with another board that I'm applied for. So I can't be in two places at one time, so
Okay.
You can't.
right now, Monday works.
I'm in two places right now.
Okay, so then it passes. Thank you. Okay, now the next question to try to narrow the focus. Do we want to, let's start off with, do we want to have one meeting a year in the unincorporated area?
I'm still unclear on the technology.
Well, so yes, we would have to find, I think it would not be good, in my opinion, to go to the unincorporated area and not have it be virtual, because then we'd be losing people.
Right.
To gain one or two who come in person. Are there, like,
The
admitters?
technology that we used when we met at the library in West Sac would be the same that we took anywhere, because I just bought some equipment that we could do virtual.
You
from
took it with you?
anywhere. And I brought it, and I bring it with me. So
Okay.
no matter where we're at, we can have virtual. It won't be as
It's not as,
clear
they can't
and
see as
beautiful as
clearly,
this.
yeah.
If we have a location that has a projector, it would be much clearer. Because we used projector in Davis, and that was much more clear than.
Winters Police and Fire Department, new building has a community room that has a projector, so we did an outreach there
Okay.
for a grant, so that might be one.
As
rural
long as I
location.
have a connection, I'll
so-
reach out.
So we don't
Yeah.
have to worry about the virtual issue. So
No,
again, the question is, do we want to go to the unincorporated areas of the county for one meeting of our 10 a year? Yes,
So if we're considering this, and if we're going to do this, then I think as a board, as a communications and education committee, we really need to publicize this, because it doesn't make sense for all these members to travel to a rural site and have no public engagement and no reason to be there in person if we aren't publicizing and advertising and having that outreach piece. It makes no sense to make the effort. So that's all I wanted to say. Think about that. If we're gonna do that, we need to get the community there, otherwise it's a waste of gas.
Is that something that the communication standing committee can take the lead of for advertising in the locations?
We've already talked about advertising every meeting.
Okay, but I'm just saying is that if we're looking at tasks for the standing committees, that's a concern, we make it an ongoing task for them to contact city council members.
Yeah, but we're all board members. You don't have to be on that standing committee to help publicize that we're traveling to.
No, you don't, but I think if you're looking for someone to be responsible to make sure that it happens, put it on the communication standing committee for those meetings in Davis, West Sacramento, or Winnet, where we're trying to generate participation, that they're responsible for
Absolutely.
outright engagement. Anyone else could add to that?
Yes, sorry. I didn't cut you off. I just-
That's okay.
Christina, just a quick question. When you're reaching out to these various locations to let them know that we're gonna come and host said meeting, would it just be possible to ask how to best get the word out to the community that we're gonna be there for on this day for this amount of time, and we encourage that locals come and participate and engage?
I have not in the past, but I'm certainly willing to if they, I'm sure they have bulletin boards we can post on.
Because I don't know the demographics, so I don't know who's on social media, I don't know the access to go into our website to see that we're now gonna be live in a rural area of Esparto, so if you can figure out how we might best be able to advertise that, then we can take the lead in doing that.
So what I have done as District 5 rep, I work through my supervisor and they have resources in their district to send out emails and notifications. So I've asked for support at the supervisor level. So that's something we all can do to our supervisors, no matter where we are. It's like, can you put this in your social media? Can you send out an email?
Okay, so again, back to the question, do we want to have one meeting a year in the unincorporated area?
Yes. I'll make the motion.
You want to?
Oh, okay.
Okay, before we, what I'd like to do is, before we vote, I just want to get some input from the public, if there is any, on all, no?
I would say change the website and go with the calendar you have.
The question is, do we want to?
That's a no.
So that's a no.
Don't.
I don't think you need to go to a rural site. I think you can modify the website to take that off
Okay.
and go with what you have.
I think you do need to look at the rural areas. It's once a year, it's part of our county. And my thought is that if it's good enough that you have a virtual response in West Sac, and the meeting is in West Sac, why would it be different to have a virtual, are we keeping track on our Zoom participants, what area of the county they're representing? Do we know that? So if we're trying to increase engagement, I think that that might be something we'd like to look at. And by participating in a rural setting, maybe you can increase the engagement on Zoom, and then maybe in the future that might not be necessary. So if you could say, yeah, our population from the rural communities has gone up, then that's great.
Okay.
But I think you need to make the step to reach out to people who aren't engaging right now.
Any comments from the public
We
who are
still
on
have a
Zoom?
public comment here, the individual.
Oh.
Well, I was just gonna say, I think it's important to rotate the site regardless, and so I think the wider the reach, and obviously the rural areas don't get a lot of attention anyway. So if this is a county-wide entity, then there should be sort of county-wide physical representation, but also Zoom is the great equalizer, right, in terms of equity. So, the great equalizer, that's an overstatement, but I think you need both. You need Zoom and also physical representation within those areas.
Thank you. Anyone, one more? Oh,
Yeah, and I think, kind of like was brought up earlier, I think probably publicizing the meetings in rural areas will increase overall participation more than simply just having the meeting in a rural area.
Yeah.
Because then again, Zoom is the great equalizer, so that if people in rural areas are aware that the meeting's going on, no matter where it is, they can attend on Zoom. But if they're straight up not aware it's occurring or when it is, then you're not gonna get participation. So I think publicizing meetings needs to be a major focus.
and I think NAMI can help with that too.
I don't think we-
Okay, how about, anyone on Zoom from the public want to comment on what we've been discussing, if you've been following?
Your way.
Do we have anybody on Zoom?
Yeah.
Okay, all right, so you made a motion?
Yeah, let's give it a shot.
So the motion is to have
One meeting
one meeting
in Esparta.
in Sparta,
Assuming that's the only
Or-
rule.
Winter.
Oh, yeah,
Or
and that's
winters.
already in there.
No, it's
it's
not.
not.
one meeting, actually, that's not unincorporated winters, one meeting in,
What's rural?
well, one meeting in how about one meeting in winters or Sparta
Okay.
per year? And that will, and we will, well, we won't have to change the website.
Why don't we do winters of the Cape Hay Valley? I think Esparta's in the Cape Hay Valley, and I'm not sure where there we have a location.
Cache
Winters,
Creek.
Yeah.
Somebody said it. That's what- 30 minutes.
The only problem about going to Cache Creek is that there are no lights, and
Yeah.
coming back, it
Yeah.
is dark.
Yeah.
Oh,
Dark.
actually, that's
Okay.
a suggestion
Very
I
dark
have.
coming
Can
back
we
from
make
the
sure that
Sparkle?
the one in the
Which is
rural
why we should
area
get a
is
bus.
during, for part of the year with longer days?
Yes,
so that
we
you're
will do
not
that.
driving
We will
out
do
in the
that.
dark.
Do
Yeah,
that,
that's
Christina?
good, yeah.
Should we consider Jonathan driving a county bus? and
Yeah,
taking us all
right.
there?
Yeah.
So it'd
I'm
be a
going to
summer
schedule it when you tell me to schedule it, so what month would you like that?
Probably
The longest time of the year.
June.
Yeah, we've
June.
done it in May or June.
June.
Because of the
June.
length of the day.
Yeah,
Okay. Is everyone clear on the motion?
so we'll stick with the website,
Well, let's
Okay.
just,
one time a year
Yeah.
during June. So we have daylight
Oh,
right
second.
back.
Second from Sue. Second from
Who's
Sue.
the original?
D.
D, okay.
All in favor, say aye.
Aye.
Opposed? Abstentions? Okay, all right.
so are we still calling it rural?
Now, well,
I think it was,
I would-
Let's call it whatever that
what
district,
proposal was
corporate.
winters or?
whatever
Valley?
district,
What about
whose district is
Clarksburg?
that? Whose
Well,
district?
yeah,
Clarksburg's
maybe
rural
Clarksburg.
too.
Yeah, Clark, not really.
Okay, I captured Winters or Sparta. Have we changed it to Cape Hay? Have we changed it to something else?
Keep it there, I say keep it back for now.
That's why I was saying if we
Or how
just
about we-
pick the supervisor Oriole district or in this supervisor's district.
How about the language be or one other community within the county? Okay.
There you go,
Okay.
okay, there we go.
in general.
All right.
Do we need to re-vote on that then? To change the language?
That would have to put the website.
We don't.
Can I go back
I
and
agree.
still ask about
Yes.
this rotation? One of the reasons rotating between Davis, West Sac, and Woodland was important was because it equalized or somewhat equalized the travel burden for members.
Well, I mean, and what I harkened back to when we've done this and talked about it and had traveled with very little to no participation is most boards, like the Board of Supervisors, they meet in Woodland, you know? So,
The Board of Supervisors meets in Woodland because this is where the county seat is. And I've never known of a Board of Supervisors that didn't meet where the county seat was. There is absolutely no requirement that this board meet at the county seat.
So you're
It's centralized,
It is not
it's
central.
more centralized. I mean, if you look at where I live at,
Where
what's
do you
that?
live?
I travel no matter what, I have to come out here to here or Sparta or Winters or whatever.
But and I go wherever it is too, but
Mhm.
it does make the burden on people who live in West Sac and Davis, and probably any other rural area, but they're gonna be burdened anyway. It does make the burden on the people who live in West Sac and Davis have to travel more or longer.
So would your suggestion be one more in Davis and one more in West Sac?
she's suggesting that we do it like we did before, which was we rotated every single meeting. So there, I mean, and it was Davis, West Sac, Woodland, and then the fourth.
And Richard Bellows would squall if he thought we were shortchanging Woodland.
Would you make the recommendation of one more meeting in Davis per year and one more meeting in Woodland per year?
No, I was making the recommendation that we continue to rotate, but I
Like we
thought
did.
it worked fine.
Pre-COVID, like we did pre-COVID.
So, but if we
So-
only have 9 meetings now, one is gone because it's in the community, it's in the sticks. So we have 1, 2, 3, 4.
She's suggesting that we rotate to those 4 places every single meeting. It'd be one of the 4 places,
I think
Woodland, Davis.
So let me ask, what would the burden on staff be to travel that often? You guys gotta take equipment, take time out of your workday and get out there and then take time to get back.
Yeah, I
Whereas
mean.
you guys are all located here,
Yeah,
right?
thank you. I think that Christina does so much of the setting up the court, so I would certainly defer to her input on that. I show up, so I don't think I have any place to complain about distance or driving, and I'm certainly open to traveling throughout our community, but I do acknowledge that Christina brings a lot with her to the offsite meetings.
And I think Christine will be humble about it, but that is a burden to ask them to travel with all the equipment set up.
I'm an hourly employee.
Overtime.
What about as a compromise, just changing one of the blue dots to green and then one of the blue dots to orange?
I know.
I gotta go back to the dots.
Having 2 meetings per year in Davis and 2 meetings per year in Westside as a compromise.
And as opposed to 1 in each.
No, as opposed to rotating every single month. 'Cause
That would,
that was what my motion was.
that would leave 1, 2, 3, 4, 5, 6 in Woodland, 2 in Westside, 2 in Davis, and 1 in the out yonder.
I think we're still asking staff to back up and travel 50% of our meetings.
I kind of want to hear from the West Sac people particularly, since that's the biggest impact, since you just have to drive the farthest, so.
Yeah, it doesn't bother me to drive here.
It doesn't bother me a little bit.
Okay.
I live in Elk Grove and I'm fine.
It's on your way.
All right, so, do you want to make a motion? Do you want to make a motion? Okay, what's the motion?
The motion is that we more or less equalize the rotation of the meetings with the exception of the rural, of the non-Davis, Woodland, West Sacramento locations that we move around.
So what you're saying is that we have 10 meetings, 9, not counting the 1, call it rural.
Right.
You're saying we have 3 in Davis, 3 in Woodland, and 3 in West Sac. Okay, that's the motion. All in favor?
Wait, we don't have a second yet, do we?
Oh, I'm sorry. We don't have a second. I'll second it. All in favor? Opposed? Opposed? Abstentions?
I'm abstaining.
Okay, all right. Motion does not pass. Okay, so I think we can move on. Any correspondence? Christina, other than,
The correspondence that's printed out, that's the
yeah,
one we're receiving.
okay, all right. We are now at Carleen time. Yeah. Mental health director's report. What items would board members like to pull and hear Carleen discuss or ask questions to Carleen?
Just one, on item E, I had a question.
You say E?
E.
Well, so E, you want to pull E? I'm just going to go through okay, E. Anything else? People are burned out. That was smart. How did you do that? What else? Anything else?
So we're sticking in this here.
Yes.
B.
B. Okay, if anyone wants any other items pulled, let me know, but we'll start with B. You want to ask?
So, how does it work? Tonight, if I need crisis intervention, what do I do?
Yeah, so I can provide an overview of what we're currently doing, and then I can answer your question. So we implemented the Medicom Mobile Crisis Benefit on January 2nd. Thank you. I really want to take a moment to acknowledge Tony and Sam, who worked tirelessly, and many others, but really for several weeks. This was an all hands on deck sprint to the finish line. And I just want to be really clear that our model right now is a pilot and is not likely to be the permanent model, but it's a pilot for right now. And so we have coverage during the day for pretty extended hours throughout the day, Monday through Saturday, with our co-responder model. After business hours, calls for mobile crisis can come from a number of ways. And I'll have Tony sort of talk through the flow a little bit, but in general, they are being routed through our access and crisis line. That's an existing line. It's our 24-hour access and crisis line. And then there's a process then for deploying. We have to be careful. We sometimes interchangeably use the word dispatch and deploy, and those are very different terms when it comes to law enforcement. And with dispatch. And so we want to be really clear. So at that point, we would be deploying, right, the mobile team. And so our after hours and weekend coverage is a collaborative effort currently. We are contracting with AMR, who is our EMS ambulance provider in the county. They are staffing a separate team, not an ambulance team. They are staffing a team that's using tell me the term again.
Quick response.
Thank you. Quick response vehicle, QRV, so not an ambulance, to respond to calls for mobile crisis. And then we have county staff on standby to be the licensed mental health professional that's required to be a part of that team. Now, they do have 2 people on the team, so they meet the requirement for having 2 folks go out. They've completed the training, so they are able and certified, trained to do the mobile crisis assessment, but we still need to have access to a licensed mental health professional, and our county staff through a standby on-call system are generously volunteering their time to cover that right now. We don't have a ton of internal staff that are signed up for these shifts. I'll be frank, there's less than 10. And so this is not sustainable long-term, right? We can't compel anyone to be on standby or on call. Our class specifications through the county don't require standby and on call for behavioral health clinicians. And we don't want to compel people to be on standby or on call, right, if possible. And so we can't mandate that people sign up for shifts. We can't require people to sign up for shifts like we can for other parts of our system that have that built into the class specifications. I will just say that the people sitting on either side of me might even be signed up to cover shifts. And so that's the current process that we're using. What we're doing over this pilot period is collecting data about how many calls we get so we can understand call volume. It can help us understand what coverage needs to look like, right? Part of the unique issue for YOLO is our geography. Many of our staff don't live in YOLO County. You just heard Christina say she lives in Elk Grove, right? We have many staff who live in Sacramento County, Placer County, Solano County, right outside of YOLO County. And so if we were only to staff this in a standby on-call sort of capacity mechanism, we would not be able to meet the response times that are required by the benefit. We have to respond to a mobile crisis call in 1 hour or 2 hours if it's in a rural area. And so to get to the county, to get a county vehicle and then to get out to a call, it just doesn't work really. So we very creatively and innovatively are partnering with AMR. They were a very willing partner in this. I want to also really acknowledge AMR. They have been a yes the whole way along here. I think it's a pretty innovative approach. There are other counties now that are also considering this approach. I'll just be frank, many counties have not yet implemented the benefit. They are very much struggling to get this stood up. And so there are several other counties that are looking at EMS as a possible solution. And so the calls are coming through access and crisis. Eventually we'll have the high-tech call center up and running. We just completed that RFP process. We've issued the intent to award. There's a protest period that's open right now, and then we'll move forward with the contract. Once the high-tech call center is up and running, that will happen much more seamlessly. There will be more integration with 988 and with dispatch. And so right now we have a flow that's pieced together in a couple of different ways. We've also communicated and worked with our law enforcement partners. Thank you, Sam wrote me a note here, that people can also call 988 to request a mobile response, and then they'll get triaged through. So if a call comes through 988 and a mobile response is needed, then 988 can help with connecting, right, to get a mobile team deployed. And again, that will be more seamless once we have our ISAC call center. The last thing I'll just say, and then I'll stop to see if there are additional questions, are that we've also communicated to law enforcement that if they're out on a call, after hours or on weekends when we don't have a co-responder on staff, that they can call the Access and Crisis line, and that we will immediately deploy the mobile team out to a location based on their determination that we need a mobile team. There's a screening process that the Access line is using to make these decisions, but we believe that our law enforcement partners truly know that someone's in need and that we can bypass, right? In some ways, we can sort of take their assessment of the situation and deploy out a mobile team at that point. So we've communicated that to our law enforcement partners as well.
So where would they be deployed from?
So they are in a centralized location.
Only two
Yeah, there's just
units,
one team.
right?
There's
So
one unit with 2 people right now.
on the west and the south side of county?
I don't know where they're stationing.
Centralized?
I'm not exactly sure.
I mean,
where they are.
I'll just share with you some data. We've gotten 0 calls. We've gotten 0 calls after hours on weekends. So I know we've.
So it'd be nice to have one in West Sacramento.
Well, we can't, I'll just say we can't afford to have teams in multiple locations, especially if we're not getting any calls yet, right? So we have to use our data. So that's part of this pilot period. My understanding is that they may be moving around the county or staying in a centralized location. But this is a fee for service, right? There's a rate that we get for Medi-Cal beneficiaries. There's no revenue coming in, but we're having to pay a lot of money for the AMR contract in particular, as you can imagine. And so this is it's a learning process for us, right? So eventually, and with additional financial resources, right, to actually support the model, we would like to have units in multiple locations, right, so they can be deployed more quickly. But
Yeah, that's what I was gonna say.
yeah, but I don't know whether we can find that out and circle back.
Well, when we had the one, I think it was the 24 service in West Sacramento, that we had a place where the police could take somebody if they needed to. That place closed up, right?
Yes.
So there wasn't much of a need, or it wasn't getting these, wasn't getting much use because the people from Woodland would have had to travel over to that area too. But we were trying to make it more efficient for West Sac PD doesn't have to travel all the way to Woodland or Davis to meet that need too. So is this something we're gonna look at as?
Yeah, that was the urgent care. I mean, I think as we've talked about here, the missing component for the Crisis Now model is a receiving center. So that's sort of the next piece that we're working to implement. Ideally, we will have our pilot receiving center in Woodland, but we're also working on a contract that's close to West Sacramento, so we're still working on that.
And this would also be, one more question, this wouldn't be utilizing the people that West Sac has hired, two individuals that would be able to go co-responders this is not the co-responders, this would be an addition to in those mobile units, right?
The co-responders are providing the mobile response during the day, during the hours that we already have co-responders all over the county, right? Because we have
Right, we have
coverage.
2 in West Sacramento, I think.
We have 2 currently, and then we have additional positions that we've actually requested through the MHSA plan.
Right.
So we have 6 currently, and we'll be increasing to 8.
And will
at
they
some
be the
point.
one manning the mobile crisis?
So they're already doing this mobile crisis response. They have been, right? That's what they're doing.
Right,
during
but
the day.
in the mobile unit itself, that goes to the different areas to respond.
No, they're responding within the jurisdiction that they're working in, right?
Okay.
So we have coverage across the county for a good chunk of the Monday through Friday, and even on Saturday, we have some coverage. So they have been already doing that mobile response. They'll now be responding either as a team or through telehealth, having a second person, because they do need to have a 2-person team that doesn't include law enforcement. So they are the mobile responders during business hours. And then the contract we have with AMR and our on-call process is for after hours and weekends,
Okay.
8 p.m. to 8 a.m. and weekends.
Thank you.
Coverage, yes.
Okay, because of time,
Yes.
I just want to ask if I can send an email as the program chair to understand this program more. I have concern when you say law enforcement partners, because we're just finding this information out, how do they know really that this program is up and running? How is each dispatcher, either at West Sac PD or at 911, how do they know that this is here and working and in the community You know, I know that the other committee, is gonna be, you know, once our 98 is up and running, you know, we can have signs to build up publication, but how do we know, like, each officer knows that this is an option?
Yeah, so we've communicated out to all of the chiefs and their assigned, whoever else they've included, with written communication that they said that they were sharing with their entire departments. They had multiple meetings with dispatch, and so dispatch is well aware. And they've had joint meetings with dispatch and with our, access and crisis line. There's been a lot of work
So
done.
they've had meetings, you've actually.
Our team,
Yeah, no, no,
sitting
yeah,
next
but
to
I mean,
me.
we, yes,
Okay.
yeah.
We've
That
had
would
many,
be-
many
so-
meetings and hours and hours and hours of work on this, Christy, for the last 30, to really a sprint over the last 30 days. I'm talking the majority of these people's time, and I'm not talking 40 hours a week, I'm talking like 60 hours a week, was getting this up and running. And so while, and I think the thing to remember is that this is a Medi-Cal benefit. We're not mandated to provide this to every person in the community. We don't want to screen out people based on insurance status, and we don't have revenue, right? There's no revenue for us to get from individuals who don't have Medi-Cal, because this is a Medi-Cal benefit only. And so we, over the long term, would love to build this out to a model where we have mobile crisis units available 24 hours a day for anyone regardless of insurance status. And there's gonna be a lot of work that has to be done from commercial insurance and other funding sources to provide us with the resources that we need, because this is currently, in the current model, going to cost us millions of dollars a year. And that's just to serve, you know, the people that we're serving now, and then the expansion with the Medi-Cal benefit.
Right, no wrong door. But can we, as a community, you know, as a communication education committee, work through and help to spread the outreach?
Absolutely.
Okay.
Yeah, so maybe
CIT training too, I think could also.
just reach out and we can work together on help on getting the information, so that's to help with the communication.
thank
Yeah, thank you.
So, I'm sorry, I'm trying to figure out whether it's actually weird that you haven't gotten any calls yet. So
Yeah.
is that, do they normally these are calls that would go to the police, but they're supposed to be going to you, but even if they go to the police, they're supposed to get redirected to you, right?
Mhm.
So did the police just, I'm sorry.
Yeah,
I'm
we
just
don't know. I mean,
confused.
it's been 1 week, right? It's been not
Okay.
even 1 week. Tomorrow makes 1 week. We
Okay.
launched last Tuesday, and
So
so
that might just be
I
normal,
think
or
it might
do we
just be
know if
early,
it's normal?
early
Okay.
signs of it. I think, you know, I don't, you know, something you want to add?
I think that we're all kind of wondering the same thing. And so part of the work of the last month, really, what Carlene's talking about, with kind of getting everything in place, was sort of like the structural components, putting contracts together, making sure that there's like a flow and everybody understands kind of how things are supposed to move. Now, just on the individual officer level, right, you know, I don't know if information has trickled down to them, right? We've provided the information, we've encouraged the chiefs.
We met with the chiefs, we
met
provided
with the
written
chiefs,
communication.
You know, so I think part of where we're at now is like where we haven't received any calls, and so that is around us starting to do work of re-engaging and saying, okay, hey, what's going on, right? Is there a hiccup here somewhere? But like, the best answer is we don't know yet, right?
As far
You
as
know?
engaging the law enforcement, what we've done with different programs is they have shift briefs. And so, when I wanted to get something out, I spent a week and I went to each one of the briefs for the agencies, about 5-10 minutes. This is what we're doing to make sure that basically the line officers heard it. But that's very labor intensive. It may not be viable, but that's just, for some stuff in our office,
Yeah, I think there's more work to be done around getting the word out, you know, and we'll continue to do that. We certainly want this to be something that's utilized. It doesn't benefit us to not have calls, right? I mean, we are getting zero revenue, but we're having to pay quite a lot of money to ensure that this benefit is available. The last thing I just want to say is that we have a separate system for children and youth that we're leveraging, another response system, which I can talk about more maybe on a future agenda, or if there's you know, another way to get the word out, but we are, and it's in our implementation plan, but we have a separate vendor for children and youth who, they specialize in working with families.
I just wanted to offer, I mean, we have board members that have relationships with, you know, local city officials and fire departments and police departments. So if we could collaborate and be of assistance in some of the outreach too, I think that we could have a partnership that would be great.
I don't know if each police department has a cab, but we can suggest or ask the chief to have somebody come in and to
Yeah, I think the other thing to
Share that,
remember too is that we have co-responders embedded in each of our law enforcement jurisdictions, not in Winters Police Department, but we have embedded co-responders who are also communicating this, and they participate in briefings and other things in the early mornings and things like that. So we're certainly not there at all to shift changes in those things. We just don't have the capacity for that quite yet.
The embedded ones might be a great tool just to,
Yeah.
because they
Yeah, and when they
overlap the briefings
Yeah,
and
and-
just hit that briefing, they're coming in or coming off, and we've got this new program.
All right.
I think you said it, I think those folks are probably the best way to get it out to the line
Yeah.
staff. Your response teams that exist in some
Yeah.
of those cities.
They already have relationships with
Yeah,
them.
and they will, hey, if we're not, after hours, this is where you call. If you're gonna call us, call them and
Yeah.
they'll get it.
Yeah, I think we want to work on getting some little cards that would be easy to hand out and things like that. So we're working on it. We're doing the best with the
Actually got a stack of stuff to distribute right now.
You just
limited.
gotta make sure those cards are the right size to fit in
All
their
right, we have
pockets.
about 5 minutes left. Nikki?
Nikki, hi, question on the.
All I wanna do is a one-word answer.
Yeah.
Is the community, I'm sorry, the work group for the Mental Health Services Act, is it meeting only virtually or is it?
Yes.
Okay, that's all.
Okay. Any public comments on, no? Okay. Board of Supervisors?
No update from the Board of Supervisors.
Yeah, I'm sorry, yeah.
Public comment for, like, anyone?
I'll ask again at the end. I was just asking about the mental health director's report. You have something on the mental health? director?
Yeah, I just wanted to thank everybody who has stepped up and joined the board and to publicly acknowledge Jonathan Raymond and Samantha for helping me out in an incredible crisis that went on during the holidays. There's a lot of really positive things happening in our county. And so I want to let you know that we all appreciate that. Please, please, please don't forget to advertise this to families. Families need to know and peers need to know that the police don't have to come, you don't have to get healthcare in handcuffs. And don't overlook the emphasis on letting families know that, please.
Thanks.
Yeah, I just want to say, like, as a consumer of mental health services in this county, like, I'm really glad that there's a move towards using clinicians to respond to mental health calls, because that's what should have been happening this whole time, but realistically hasn't been. So like the co-responder model that has been extremely helpful. And I'm glad we're continuing to move in that direction.
Thank you.
Yeah, I want to echo that. And I can't imagine how much time you spent to get it stood up so quickly. So that's
The
great.
bulk of that,
Yeah,
I have
I
to
hope,
credit
I
Tony
hope,
for.
I hope it doesn't, I just hope it doesn't turn out like the urgent, what was it called?
Urgent care.
We
Yeah.
don't,
Yeah.
Jonathan, don't
Yeah,
care.
yeah, I just.
Don't jinx
Yeah, exactly, yeah, but, because it's what's needed, like you said.
Yeah, no, we're committed to identifying a sustainable model, right? I mean, for us, we know this is a benefit that's going to improve the quality of life for our neighbors, our family members, our friends, and we know this is the right thing to do regardless of the cost, right? But we can't bleed money, right? And so we have to strike a balance. We have had a meeting with DHCS. We are sharing our data with them. This is a sort of unfunded mandate, and so we may have some mechanisms to seek reimbursement for our costs, right? Even if we're not getting calls. And so we're working through the resources that we have available to us, and we intend to continue this benefit and to strike the right balance on how to ensure that mobile crisis is available 24 hours a day.
Can I throw out two more if people don't overlook apartment managers and also business owners. Community engagement with business owners in the community so that they don't think the only resource they have is call the cops. Please.
Exactly.
I don't know if I can speak on behalf of the mental health director, so, Carlene's right, like many counties, I have not implemented the benefit, and in part because it's overwhelming, right? What needs to be in place to actually do this 24 hours a day, 7 days a week it's incredible. And, you know, whether we'll admit it or not, I mean, we were considering not doing it, right? Because it just seemed like it was impossible.
Delaying.
Delaying it, thank you. See, that's why I can't speak for it. But we chose not to because it's so important, right? I mean, we chose to take it on and put it together because it is so important for this community to have this as a benefit, right? And it's fragile still, right? And so I think that that's the biggest part that I'll say just from kind of being behind the scenes and putting it together is that it's still fragile, right? You know, Carlene's right, we have a handful of clinicians that are gonna be working like after hours and on the weekends, including yours truly, right? But we're all dedicated to it, right? Like we want it to happen, right? Even, you know, even despite the fact that the model that we have is not sustainable. The model that we currently have, we cannot do this forever, right? It's just to get us here and to the place where we can have the real model like down the road, right? So if there's one thing I hope you can take away from this is like that this is not gonna look perfect, but like we're dedicated to it. Like we really believe in it and we did whatever it took to make it happen. So.
Thank you.
So it's a learning experience.
Oh, yeah.
Thank you.
Yeah,
Thanks.
we're
You can
learning.
just put your number, your cell on the flyer.
Pretty much the case.
Okay, Board of Supervisors.
So I'm Yulia Bodanu. I'm the deputy to Supervisor Villegas. I snuck in on the previous meeting, but now I'm officially here and I remembered my name tag, so that's good. So I'm sort of learning sort of all of the things that Supervisor Villegas is involved in, and this is one of them. And also my own personal background is that I used to be the administrative support for this board. So I have a vested interest.
It's a very
in
small
this.
number of us who remember.
It's true, it's true. So sort of, you know, the institutional knowledge resides somewhere in the back of my mind. And so I'm here as an advocate, obviously to Supervisor Villegas and then also the remainder of the board. So if, you know, things, and I say this very, like, if things need to be escalated, and it seems like you guys are doing a great job of managing all of the moving parts of the board, I'm here as a resource. So thank you, and you all are doing a tremendous job, and the level of engagement that I'm seeing is absolutely wonderful, given, you know, sort of the personal, you know, connection that I have to everybody and that is still around, and also new board members and such. So happy to be here, and if you have any questions or, you know, sort of, yeah, have any questions, you can let me know afterwards. Yes. Say it again, say it again.
Tweet our
We do have a newsletter, so we will put that in. I know that's a little bit antiquated. It's not tweeting, but it's close.
Okay.
It's close. So yes, absolutely. We'll use our resources to help however possible.
Well, thanks for coming.
For sure, absolutely. Thank you.
Okay, Chris?
We have a mental health court graduation on January 22nd at 2:00 in Department 5. As far as going out into the community and seeing what works, I encourage any board members to come in and observe that. It's a real success story for those people when they graduate.
Who's graduating?
Walter is.
Right.
Other than that, we are working on standing up a youth court, which will have some behavioral health components, and that's in its infancy right now. At 8:05, that's all I'm gonna say.
Okay, any more public comment?
There's one public comment on the screen, and it says, what are you doing?
How do you support?
Yes, how do you support?
How do you support members?
Well, we're not, so public comments, if you can hear me, they're not really questions, but if you have a comment, you can make a comment. I mean, we can read that.
It's just, it's about, I think,
Non-English.
I won't answer, I'll just say in the meeting materials, our mobile crisis implementation plan is included, and it speaks to how we provide services in threshold languages and to other, you know, individuals who are not English speaking. So there's more information.
Okay. Anything else? Public comments?
Just want to say I appreciate on the county side, like the effort made to kind of making this a reality. Because the thing is, like, this impacts real people who live in this county, and very clearly, like, a lot of people have been failed by the current system, like especially of like over medicalization of mental health care and also like criminalization of mental health care. And I'm glad things are moving towards like a clinical role rather than like a medical or like a law enforcement kind of response.
Thank you. Okay, we're adjourned.
Second.
You read my mind?
We adjourn? Sorry.
Can I just park right up front?
It's like 5 minutes. We have to-
Oh, yeah.
I mean, I know what it is. No, it's okay. It's okay. Do we need to do a thing? Okay.
So we could have had 3, 3, and 3, huh?
Yes.
Yeah. I looked at